Next will be Ginny Levinson.
Good evening. Thank you to Attorney General Coakley and the Department of Public Health for this opportunity to testify tonight and for holding similar hearings in the 5 other Caritas host communities. My name is Matthew Wilson, and I'm a campaign director at Healthcare for All. Healthcare for All is a statewide advocacy group that seeks to create a consumer-centered healthcare system that provides comprehensive, affordable, accessible, culturally competent, high-quality care and consumer education for everyone, especially the most vulnerable. We work to achieve this as leaders in public policy, advocacy, education, and service to consumers across the Commonwealth. We work to bring social justice values into the healthcare system. We are looking forward to engaging in this public process before the Attorney General and the Department of Public Health's office, both through these formal hearings and through the entire deliberative process. It is vital that all the stakeholders analyze the impact of this proposed conversion on the affordable accessibility and quality of care at St. Elizabeth's and the other 5 Caritas hospitals. These discussions will help this proposal in its attempts to meet the Attorney General's standard of serving the public interest and the needs of the host communities. This conversion process the public hearing process that began 2 weeks ago, has added importance as the stakes have grown over the past few weeks. According to the Boston Globe, Cerberus appears not to be stopping with these 6 proposals before us, and is already looking at its next batch of acquisitions in Rhode Island and the Merrimack Valley. What is decided here will have an impact on future considerations. Healthcare for All believes that community hospitals are indeed an integral part of the community fabric and its well-being. When run well, these hospitals provide vibrant and robust outreach care and support for the communities they serve. We need to make sure that community hospitals continue to provide top-notch, affordable, accessible, and high-quality health care that we know and expect from facilities like St. E's. We certainly recognize the issues currently facing Caritas and its operation. We understand the pension fund is broke, and we know the physical plants are in need of upgrade and repair. We know that Caritas has been looking for an infusion of capital for over 5 years. And you've heard and you'll hear throughout the night the testimonies of the dedicated staff from St. E's showing their enthusiastic support for the proposal because it will fund the pension system and improve the facilities in which they work. The investment of capital is certainly a good thing for the past, current, and future employees of St. E's. So Healthcare for All is here today and is focused on this conversion process because we want to make sure this proposal on the table before us is the right deal to make. Not only for jobs and pensions, not only for the construction projects, not only for the local tax base, but for the health care that the community it serves. We know that Caritas and Cerberus have negotiated many hours to formulate this deal. Now we need to expand the circle of discussion, include a new set of eyes, and give the public a seat at the table. Cerberus has put an offer on the table which will bottom line change the ownership of St. Elizabeth's and the Caritas network from the Archdiocese of Boston to the New York-based equity firm Cerberus, a venture capital firm that has never owned nor operated a hospital. This conversion raises many questions. After the first 2 hearings which we've attended, we are concerned that this process is being viewed as a thumbs up or thumbs down matter. It's a take it or leave it process. History shows this is not the case. While there's been some conversion applications that have not been approved or have been withdrawn, many have and have all been approved with conditions that improve upon the original proposal. The North Shore Medical Center conversion in 1997, the Metro West Medical Center conversion in 2004 are 2 prominent examples. We have heard from Dr. De La Torre and others who have spoken with true passion and dedication about the benefits of this proposal. But that is not to say that this proposal doesn't have room for improvement to ensure the accessibility, affordability, and quality of care for residents here in Boston and beyond. This particular conversion proposal raises a number of important issues. First, there's a significant difference between a nonprofit and a for-profit hospital. One is you have to pay taxes, and from testimony earlier, an estimated $100 million a year. Second, you have to deliver profit to your investors, which is the bottom line business of Cerberus. It is important that all interested parties acknowledge that the conversion to for-profit status is not simply an administrative change, but it's a substantive change in corporate structure with significant practical implications. What does this conversion mean for Cerberus? Well, over the past couple of years, Caritas has been able to shift from a money-losing operation to a company that's operating in the black. If this deal goes through, they will have a few more lines on their expense sheet that were not there before. Paying taxes, local, state, and national, providing returns for their investors, and continuing to fund their pension fund. So we ask, where's the money going to come from to fund these new expenses? Cerberus will either need to increase its revenues or decrease their expenses to meet these new demands. So we ask, how are they going to do that? After the initial 3-year commitment that is in the conversion, which guarantees staffing levels and the administration in place, what will the future bring? We worry that Cerberus may reduce their staff. When Cerberus bought the supermarket chains Albertsons and Mervyn's, they laid off workers. We appreciate and are in full support of the current contract agreements that are in the proposal that will protect SCI workers for the near future, but we're concerned about beyond that. Second, Cerberus could shut down underperforming hospitals. When Cerberus brought Albertsons and Mervyn supermarket chains, they closed down underperforming stores. Caritas can also eliminate costly programs that do not produce significant revenue, such as mental health and substance abuse care, which are core programs here at the hospital. And finally, Caritas could increase the overall volume of patients and procedures done at the hospital to earn more revenue. These are some theoretical possibilities and concerns of how to meet those new expenses. We're not passing judgment on any of these options. We just want to know what the plan is as to each of these options and any others that will have an impact on the accessibility, affordability, and quality of health care here at St. Lee's. Our second key point is, does the price tag upon which the two parties have agreed adequately represent the true value of the network? We again urge the Attorney General to use her power to hire an independent analyst at Cerberus' expense to evaluate the assets and liabilities of the network. 3, we ask, why has Cerberus failed to propose the formation of an independent foundation based in also Brighton and the other 5 host communities to provide the community resources to address local health concerns? Such foundations are usually staples in similar hospital conversions. Yeah. And 4, how can we ensure that the conditions set out in this agreement are measurable, reviewable, and enforceable? We are ready to work with all parties, especially the public and other stakeholders, to do the due diligence necessary to make the process a thorough and effective one. We are encouraged by the improvement in management of the Caritas operation over the past 2 years and the ability of the current management to right the ship. With the health of so many residents at stake, we want to make sure the potential new ownership will have the capacity and will, both now and in the future, to continue to provide accessible, affordable, and high-quality care to the residents of Alston, Brighton, and beyond.
Thank you. Ginny Levinson.